We're down on Georgia Tech's campus this morning with Julie Swan. She's one of the three co-directors of the Georgia Tech Health and Humanitarian Logistics Center. And we're going to be talking about the genesis of the center, its accomplishments so far, and its future. First off, why did you folks decide to come together and start this center? What was your purpose and what was your inspiration?
I think there's several reasons that the Health and Humanitarian Logistics Center started. One of these is that there were a number of events that occurred as the century turned over. So, for instance, there was the tsunami in Southeast Asia. There was Hurricane Katrina, and we all saw the images on TV with people in need, difficulty in reaching the populations, partly because of logistics. And I think there was a recognition that engineering, science, and technology might be able to help in some of the problems in those settings.
We're here with Pinar Kiskinajak. She's one of the three co-directors of the Georgia Tech Health and Humanitarian Logistics Center. Now, what do you think the impact of the Center for Health and Humanitarian Logistics has been so far?
So we have activities in three areas: research and projects, education and outreach. On the research and project side, we have primarily two goals. We try to identify topics which are of interest to either NGOs or governmental organizations which are active in the humanitarian sector, and we try to focus on problems which are really key problems that they are trying to solve today, or maybe looking into the future, that's something that's important to them. So that's one piece. And then the other piece, of course, is to have a positive impact from an academic perspective, advance the knowledge, the science and technology that can actually contribute to these areas.
Now, looking to the future, what new initiatives do you think the center needs to undertake?
So far, our projects had been somewhat limited in scope, which was expected because we were just getting into this area. Many of the organizations we worked with had never worked with industrial engineering department before. Some of them had never worked with academia before. So this was a truly new concept for them. And at first they were quite skeptical that academia could actually do anything for them. They thought we were in the ivory tower and we are not interested in doing anything that has practical impact. And they had the attitude of, what do you really know about what we do and what can you do for us? So we had to pick projects at the beginning that were relatively limited in scope and that we could complete in a relatively short amount of time to show them that we could actually do something for them. So that has been our initial focus and goal. And I would say that we achieved that goal pretty well. So now when we speak with them, when we approach them with ideas, they are much more open. They actually come and find us now because they know that we have done things in the past which have been quite useful for them. Moving forward into the future, I think our goal will be to get into projects and activities which are of bigger scope, which might not limit themselves to a small part of a single organization, but which might lead to a transformation in the entire sector. So I would like to give an example from a project that we did with CARE. They approached us in 2007, and they were exploring the possibility of pre-positioning inventory in some of a potential 10 to 15 warehouses that currently exist all over the world. We recommended that they should pre-position inventory in 3 or 4 warehouses because going beyond that basically had diminishing returns and would not really help much. However, if they pre-positioned inventory in 3 or 4 warehouses which were scattered around the globe, they would achieve significant reduction in response time, which was very important for them. So they actually followed our recommendation with some slight changes in the locations, and currently have inventory pre-positioned in various locations. And another impact of this has been CARE's ability to approach potential donors and explain to them the benefit of doing something like that. Before, if they just went and said, please make funds available for pre-positioning without any explanation as to why this would be a good idea, maybe they would have a hard time. But but having some academic study scientifically saying that this has significant benefits also help them in approaching their donors.
Aslam Ergin is one of the 3 co-directors of the Georgia Tech Health and Humanitarian Logistics Center. Dr. Ergin, would you please discuss the center's activities with the World Food Program?
Sure. And with World Food Program, again, it's an organization that we have been working with for several years now, and we have done multiple projects. We also had one of our undergraduate students, a graduate of us, work in logistics development unit there for about a year as a full-time employee. And currently we have a PhD student who's interning at the same unit in Rome at their headquarters for about 7 months. She was also there during the summer. So she's basically, her PhD thesis is really centered around some of the WFP's logistics problems. In general, what I found is that the people who work in this sector sometimes have the attitude of, we do something very different than what the commercial sector does or other people do in regular circumstances. We work in the parts of the world that nobody else goes to. There's no infrastructure. There's you deal with people who are very different than you will any other company or any other organization will deal with. So we're doing the best we can under those circumstances. So one of the things that was very hard, or is still very challenging to kind of get across, is that first step of, you're doing great under the circumstances, but there are still a lot of ways that we can help you to improve your operations.
The whole idea of continuous improvement.
Yeah, the whole idea of continuous improvement. And you get different people in different organizations with different attitudes. I mean, one of the reasons why we have been so successful in our relationship with the World Food Program is because when I first started working with them, their logistics director was this very influential and charismatic guy who also believed in continuous improvement. And he believed in working with academic institutions, and he believed that no matter what, every organization had room for improvement and they have to learn.
I think that most organizations have a desire to improve, although it sometimes is driven for different reasons. So perhaps industrial engineers have a desire to improve because that's part of our personality, our nature, to keep improving systems, and that's why we went into industrial engineering. Sometimes there's pressure, for instance, in non-governmental organizations from donors and funders of activities, and there's pressure to constantly improve in terms of how much of a dollar you're able to provide to the actual people in need. This can be a little bit of a tricky situation because if the emphasis is on, for instance, how much is provided to the person or community in need, there can be time and resources taken away from actually improving the system. And it's not what the NGO would like to do. Of course, they would like to improve the system. They would like to put in technologies that help them track inventory and provide visibility and help them make decisions. But there's this trade-off between what the donors are asking for in the short term, which is to provide as much as possible food, water, medical supplies, whatever it might be, to the community in need, which is clearly important. But I think that one of the roles of IE is to help the process of improving the system so that ultimately it's not just how much of today's dollar you provide to the community in need, but of tomorrow's dollar and the dollar after that, where as you improve your system, you're able to more effectively use your resources to make decisions that help the people in need.